Gastrointestinal cancer surgery is a major step, and one of the most common concerns patients and family have is, what does recovery actually look like? In this video, I'll walk you through the journey step by step, from the first 24 hours in the hospital to weeks and months at home, so you know exactly what to expect and feel reassured. Hello, I'm Dr. Vivek, a GI Onco-Surgeon at SSO Cancer Centre. My work focuses on cancers of the stomach, colon, rectum, esophagus, and other parts of the digestive system. Over the years, I've seen how fear of the unknown can make recovery feel harder than it really is. My aim here is to simplify the process and give you and your family a clear picture of how life unfolds after GI surgery. Once the operation is complete, patients are usually shifted to a recovery room or ICU for close observation. This does not mean something is wrong. It's simply to ensure complete safety. We continuously monitor blood pressure, heart rate, oxygen levels, and urine output, as these give us clues about how the body is coping after anesthesia. During this time, you may notice IV lines for fluids, a urinary catheter, and sometimes small drains near the wound. These are temporary and are there to support healing. Pain is kept under control with techniques like epidurals or patient-controlled pumps, so patients remain comfortable enough to breathe deeply and move slightly. Eating is not allowed immediately. Intestines need time to wake up, so we usually begin with sips of water or clear liquids once recovery is stable. Nurses will also encourage deep breathing and gentle leg movements to prevent clots and pneumonia. The first 24 hours are all about stabilization and reassurance. Food is reintroduced gradually and step by step. We usually start with clear liquids such as water, coconut water, or thin soups. Once these are tolerated, patient moves on to full liquids like juices, milk, or dal water. After this, soft foods like khichdi, porridge, or well-cooked vegetables are introduced. Only after the body adjusts do we progress to a normal diet, while avoiding very oily, spicy, or heavy meals in the beginning. Each patient progresses at their own pace, and your surgeon and dietitian guide this carefully. The idea is to give the digestive system enough time to adapt while keeping nutrition in focus. It may feel counterintuitive, but lying in bed too long is not good after surgery. Early walking plays a vital role in recovery. Getting up with assistance as early as the first or the second day reduces the risk of blood clots, helps the lung expand properly to prevent pneumonia, and even stimulates the bowel to recover faster. Walking also has a psychological benefit. Each step builds confidence and reassures the patient that they are on the path to healing. Rest is important, but movement is medicine too. Families often wonder how doctors decide when it's safe for a patient to be discharged. There are few clear indicators. Vital signs should be stable, pain should be controlled with tablets instead of injections, the patient should be able to tolerate light foods without major nausea, and there should be signs of bowel function returning, such as passing of gas or stool. The wound should look clean and healthy without signs of infection, and finally, the patient and family should feel confident in managing care at home, whether that's wound dressing, stoma care, or medicines. Once all of these conditions are met, do we advise discharge. Caring for the surgical wound at home is straightforward but very important. The incision should be kept clean and dry, and hands must be washed thoroughly before touching the area. Follow your surgeon's instructions when to change or remove the dressings. Avoid powders, harsh antiseptics, or scrubbing the wound unless specifically advised. Most wounds heal smoothly, but it's important to watch for signs of trouble such as redness, swelling, pus, fever, or if the wound edges starts to open. Reporting this early prevents bigger problems. For some patients, surgery may involve creating a colostomy or ileostomy, which may be temporary or in some cases permanent. The early days may feel overwhelming. The stoma looks new, the bag feels unfamiliar, and the patients worry about leakage or smell. But with guidance from stoma nurses and practice, most patients learn to manage confidently. Over time, the stoma just becomes another part of life, and in the long term, most patients go back to work, travel, exercise, and even swimming. A stoma is not the end of normal life, it's a tool that allows safe surgery and dignity after surgery. Once patients are home, diet remains a cornerstone of recovery. The best approach is small, frequent meals that are nutrient-dense. High protein foods such as eggs, dairy, fish, or pulses support healing. Fruits and vegetables should be reintroduced gradually, especially if raw ones cause bloating initially. Sugary, fried, or very oily foods should be limited in the early weeks. Hydration is important, but water is best taken between meals rather than in large amounts during meals. Over time, most patients learn what suits them best with guidance from the dietitian. The abdominal wall and stitches need time to heal. That's why we avoid lifting anything heavier than 2 to 3 kilos, roughly a grocery bag, for at least 4 to 6 weeks. Gradually, activity can be increased. By 3 months, many patients can return to normal lifting and even exercise, provided their surgeon clears them. Gentle walking, stretching, and breathing exercises are safe from the beginning and actually help recovery. Inside the abdomen, the body naturally forms scar tissues called adhesions. In most patients, these do not cause major issues, but in a small percentage, they can lead to bloating, discomfort, or even bowel blockages months or years later. Staying active, eating a fiber-rich diet, and avoiding prolonged constipation help reduce this risk. If severe symptoms do occur, surgery to release adhesions may be needed, but this is uncommon. Finally, the most important aspects of recovery is knowing when to seek help. Do not ignore red flags such as high fever, severe or worsening abdominal pain, persistent vomiting, inability to pass stool or gas, redness or pus from the wound, unusual bleeding, or sudden chest pain and breathlessness. These signs need urgent attention. Early reporting can prevent small issues from turning into major complications. Recovery after GI cancer surgery is a journey that unfolds step by step from hospital stay to home care, diet, activity, and long-term adjustments. While every patient heals at their own pace, understanding the process helps reduce the fear and builds confidence. With patient guidance and awareness, most patients return to full and active lives. If you found this video useful, please share it. It may reassure another patient or family preparing for surgery. Don't forget to like, share, and subscribe for more patient-focused education on GI cancer care.